Live from ABC7, this is Eyewitness News.
And as Sid mentioned, the air quality is really challenging out there. And we have joining us right now our guest, Dr. Eric Presser. You wrote the book, Empowering Guide to Lung Cancer. So you are a lung specialist, and I understand that you were actually there at 9/11 and treated people who had to endure and breathe in all the awful particulate matter from that situation in New York. So here you are helping us get a better understanding on how bad this smoke and the particulate matter that people are breathing in is. First of all, why is it so bad for us?
Well, smoke has a lot of toxic effects. The byproducts of smoke, we all know about carbon monoxide and how that can decrease the amount of oxygen in our blood, leading to our heart and our brain. But what fire does is it burns particulate matter, and it causes these particles to be ingested. And it's these particles that we're not so sure about what they do long term. We all know that when we are ingesting smoke and particles that we can't breathe. We start to cough. We start to have watery, itchy eyes. And a lot of people will go inside, okay? That's what we tell them to do. But unfortunately, just like we experienced on 9/11, the air quality and these particles, you can actually taste them for weeks after the devastation. And we all had to walk around with proper masks. When you see, or when I'm seeing these people being interviewed and they're outside and they don't have a mask on, it's kind of like what's going to happen later on.
Oh gosh, that's scary. That's sort of a scary image, because there's so many people right now who are dealing with poor air quality. Can you talk about the people who, I mean, you can see the smoke, and with our live coverage that we've been having several fires burning right now, people are staying inside. What's your advice to those who have compromised immune systems, they have asthma, they have lung problems?
Sure. So obviously the first thing to do is don't smoke. I mentioned that in my book. It seems obvious, but a lot of people, when they want to relax, they'll light up a cigarette. And the smoke that they're inhaling outside is the same as you would if you light up a cigarette. So try to stay inside. Run your air conditioner if the air conditioner is not drawing air from the outside. Don't vacuum. Don't dust. If you have to dust, make sure you use a wet cloth so the particles aren't thrown up into the air. You want to decrease the amount of particles that you are actually exposing yourself to and what you are actually breathing in.
What about your car? If you're driving, and so many people drive in Los Angeles and they can't help it, but they have to be out there, what should you do if you're in your car?
So once again, you have to make sure that if you put the air conditioner on, that you push that little button that makes sure that you're not circulating air from outside. And obviously try to get to where you're going as quickly as you can, and try to decrease the amount of exposure that is detrimental to what's going on with these fires.
What's your advice if people are starting to, you were talking about watery eyes, if they're starting to feel some of the symptoms, what can they do now? So like any other exposure to toxic substances, unfortunately, we can't necessarily see the particles that are causing these. So the best thing you can do is get yourself inside, get yourself away from whatever it is that's causing it, which is why we have special masks now that we all have an earthquake kit, for example. So why not put together a little fire kit? Have it next to the earthquake kit, and that way you have the proper equipment if you need it. Because from what I've seen in the 5 years that I've lived here in California, I've seen more fires than I've ever seen in my entire life.
Oh yeah, it's been really, especially lately, and this past year alone has been a really bad one. Since we have you here, what did we learn from 9/11? We saw those buildings go down. We saw the smoke from the fires in the planes. But when those buildings came down, we saw so much. I don't know how you even describe it, but particulate matter hit the air. What did we learn from all of that and the people that breathed it in?
Well, we're still learning, because when I was in New York, we would see a lot of people that were exposed, and they would have effects years later. Common sense tells us that the only thing that we should be breathing is air. I was quoted recently, and I should actually revise my quote and say it's not just breathing air, it's breathing quality air. or clean air. So there's no study that's ever going to be done that's going to clearly tell us what the effects of 9/11 or even these fires are. But common sense tells us that when your body is exposed to such toxic substances, that it's going to have a short and eventually a long-term effect. We're all getting older, unfortunately. We're not getting younger, okay? And our body is like a machine. So the better you take care of the machine, the longer it's going to last.
Right.
Good information.
Dr. Eric Presser, thank you so much for coming in, and you have given us great insight, because the folks who aren't by the fire, you're still in danger when it comes to the air quality that we're dealing with, especially today and probably for the rest of this week.
Absolutely.
Thank you so much.